Question number 2 in the name of Deputy Caoimhghín Ó Caoláin.
I seek from the Minister advice of his intentions in terms of addressing the quite dreadful circumstances that a not insignificant cohort of young women currently face and their families, consequent on, they believe, the introduction of the Gardasil vaccination at the school level.
Thank you. Minister.
Thank Deputy Caoláin for raising this matter. I'm aware of the claims of an association between the HPV vaccine and a number of conditions experienced by a group of young women. I want to make it quite clear from the outset that anyone who is suffering ill health is eligible to seek medical attention and access appropriate health and social care services, irrespective of the cause of their symptoms. People are assessed for medical cards, disability or carers allowance individually, and the assessment takes into account their family income and their individual needs, rather than a specific diagnosis. In particular, people who are suffering from the conditions raised by Deputy Caoláin in his question, complex regional pain syndrome and postural orthostatic tachycardia syndrome, don't have to prove that the cause of their symptoms is caused by anything in particular to be eligible to receive treatment or to access other appropriate services. Young women and their families should seek medical advice from their family doctor in a normal manner and be guided by this advice in accessing appropriate services, including specialist opinion where necessary. The HPV vaccine was introduced in 2010. It protects girls from developing cervical cancer when they are adults and is available free of charge from the HSE for all girls in the first year of secondary school. Gardasil is the vaccine used by the HSE in the school immunisation programme, and over 100,000 girls have received the vaccine since its introduction. While no medicine, including vaccines, is entirely without risk, the safety profile of Gardasil has been continuously monitored since it was first authorised, both nationally and at EU level. Each year in Ireland, around 300 women are diagnosed with cervical cancer, and the HPV vaccine protects against 2 high-risk types of HPV that cause 73% of all cervical cancers. It appears that some girls first suffered symptoms around the time they received the HPV vaccine, and understandably some parents have connected the vaccine to their daughter's condition. However, the European Medicines Agency has recently completed a review of the vaccine. The review, which the Health Products Regulatory Authority, HPRA, participated in, specifically focused on 2 conditions, which I've already referred to, and found no evidence of a link between the vaccine and these conditions. I want to emphasise clearly the expert findings that the HPV vaccine is a safe vaccine and encourage all parents to have their daughters vaccinated. This will reduce the numbers of deaths from cervical cancer, head and neck cancers and other cancers in years to come.
Thank you. Deputy Ó Caoláin.
Minister, your reply will offer no comfort to the some 130 families who are now associated with the campaigning group Regret. And we also have to take on board that the Health Products Regulatory Authority has received 919 reports of adverse reactions and events associated with the use of Gardasil in Ireland. So the 130 families, girls that we know of, it indeed could be a much greater number, and it can of course present by degrees. And what are we talking about? We're talking about these 130 young women displaying debilitating long-term and chronic symptoms that include severe fatigue.
Sorry, Deputy, we're over time.
Oh, sorry, I beg your pardon. Well, I'll conclude with this: short-term memory, concentration, and short-term memory and concentration deterioration, food intolerances, visual disturbances, noise sensitivity, severe headaches, burning muscles and joint pain. Minister, my question asks, will you ensure that these young women and their families would have access to such benefits as disability allowance, carers allowance, medical cards, and what other appropriate supports are deemed necessary. Will you and your department look favourably on their particular circumstances and needs?
Obviously, when it comes to carers allowance or carers benefit or disability allowance or disability benefits, that's a matter for the Department of Social Protection. But nobody gets carers allowance or disability benefit based on their diagnosis or based on a particular set of symptoms. Everyone is assessed individually. You know, even if somebody has a very serious illness, say very severe cancer, for example, they don't automatically get disability allowance. Everyone is assessed individually based on their income and their needs, and that's the same for everyone, regardless of what the cause is or what they may believe the cause is. Similarly, when it comes to medical cards are assessed initially based on the income of the individual or the family, and then what is taken into account, particularly when it comes to discretionary medical cards, is the cost of their medical treatment and other potential needs. You know, I'm sure the deputy knows this from his own work as a deputy. It's not that anyone has an automatic entitlement to any of these benefits based on what symptoms they have or what they believe the cause of symptoms may be. People are assessed individually based on their income initially and also their needs, and that's the way it is for every citizen.
Deputy Ó Caoláin.
Well, what I would like to see, of course, is a situation where everyone will be entitled. Unfortunately, that is not the case, and you have made the exception in relation to some specific areas of need, and particularly children with cancer symptoms only in the very relatively recent past. We're looking at a situation where not only the 130 young women of whom we know, but possibly many, many more, but their families, for whom in some cases their lives are absolutely suspended. Work and other opportunities in the fulfilment of life's hopes have been set aside in order to provide the supports and care for their daughters. It is imperative that some measure of recognition and some realistic reach out is organised. It isn't good enough to just reject their strong belief in relation to the underlying causes of their daughters' conditions, and we have to take on board the facts that they outline. So again, I'm appealing to you, Minister. They will be before the Health Committee later today, the representatives of Regret. What would you say to them if you were, as I am, a member of the Health Committee?
Stick to the time limit, because all you're doing is preventing other deputies from their question. So please, thank you.
What I say when it comes to medical cards, and I agree with you, it would be ideal if everyone had a medical card, but it's not. We have a means-tested system, and people are assessed according to their means, not according to their diagnosis. But the assessment when it comes to discretionary medical card can take into account the burden of the illness and also the cost of those medical needs, but that's assessed individually. It's not. And that's the way it's done. I think after an expert group reporting on that not too long ago, most people accept that that's the best way it's done. In relation to the adverse reactions that the Deputy refers to, up to the 27th of November, HPRA had received 936 reports of adverse reactions and events. It should be borne in mind that's out of 100,000 people who've received the vaccine. The vast majority of the reports received by HPRA have been consistent with the expected pattern of short-term adverse side effects for the use of any vaccine, as described in the product information. The most frequently reported side effects are local redness and swelling at the point of injection and fever. These are usually mild and temporary reactions to any kind of vaccine. Fainting has occurred after vaccination with Gardasil, especially in adolescents, and less common reported side effects from Gardasil include pain in the injected arm site, bruising, itchiness, red hives and wheeze occur on occasion. Like most vaccines, severe allergic reactions are very rare. The fact that a suspected adverse reaction has been reported doesn't necessarily mean that the medicine or the vaccine has caused the observed effect, which may also be caused by the disease being treated, a new disease the patient has developed around the same time, or by another medicine the patient is taking, and further data is usually needed to complete the picture.
Thank you. Question number 3.